back, YouTube family. Before I begin this news story, remember to hit the notification button, like and subscribe to my channel to view relevant content. And please tell your friends and family as well. Let's begin. A woman had a life-changing and debilitating experience at the VIP plastic surgery on Sunridge Heights Parkway in Henderson in Las Vegas. On December 2nd, 2021, Crystal Touch made an appointment for a minor cosmetic procedure. Her intention was a non-surgical rhinoplasty to improve the aesthetic contour of her nose. The office procedure consists of Crystal Touch having an injection in her nose. In the syringe was hyaluronic acid with the brand name Restylane. Restylane is an injectable dermal filler used to treat wrinkles, folds, and other facial imperfections. It's made from hyaluronic acid, a naturally occurring substance in the body that helps our skin retain moisture and volume. Restylane injections are commonly used for lip augmentation, plus treating wrinkles around the mouth, cheeks, and forehead. The results of this treatment can last up to 18 months, depending on where it was injected. YouTube family, many of you may have heard or know details about Restylane. And for those of you who may not, here are even more details about it. Let's get back to the story. Crystal Touch's vision for her new nose would be having her nose bridge built upwards and the tip will be slightly lifted. She mentioned that the procedure is known as a Tinkerbell lift, like Tinkerbell and Peter Pan. A registered nurse named Diane Hamill performed the rhinoplasty procedure independently, which was not the plan at all. Diane Hamill injected the tip of Crystal Touch's nose. Instantly, Crystal Touch felt the Restylane flow straight to her left eye. Right away, Crystal Touch's eye began tearing and she started blinking nonstop. Once that happened, Crystal Touch told Diane Hamill that she could not see. Plus, she was experiencing some pain. Unfortunately, Diane Hamill continued to inject more Restylane over and over. As she injected the Restylane, Crystal Touch's pain became even worse. It's only when Diane Touch began to cry and said that she can't bear the pain any longer, Diane Hamill finally decided to listen and stop the procedure. This is so tragic. A simple in-office cosmetic procedure turns into a fiasco. The worst aspect of this story. After Crystal Touch experienced problems with her left eye and pain, Diane Hamill sought out the doctor. The main problem is Dr. Carsandi was scheduled to be present during the entire procedure. Her original appointment was to be seen by him, but instead Diane Hamill went into the medical fridge, took out the equipment, and began the procedure independently. For some reason, Dr. Carsandi wasn't present. Unbeknownst to Crystal Touch, Dr. Carsandi delegated all or many of his obligations and responsibilities to Diane Hamill for the patient service. According to a publication from the Nevada State Board of Nursing, Diane Hamill cannot prescribe, self-furnish, and or self-administer Restylane injections to a patient as a nurse by herself. Dr. Carsandi was supposed to treat Crystal Touch. He is supposed to supervise the cosmetic medications, medical equipment, and check the medical tools accessibility by the nurse. When Diane Hamill went to retrieve the doctor, he did not arrive immediately. Doctors are required by law to arrive promptly to provide physician intervention due to complications. Dr. Chrisandy should have provided consultation and observed Crystal Touch thoroughly. Crystal Touch did not have the mandatory interaction with Dr. Chrisandy. Her appointment was scheduled for 10 a.m. Her procedure was done later, much later. When he did arrive around 11:53 a.m., Crystal Touch told him that she went blind. Dr. Chrisandy did not have bedside manners. Instead, he allegedly treated her like she was a burden to him and yelled at her to open her eyes. YouTube family, in my opinion, Dr. Chrisandy was absolutely rude, unprofessional, without concern for her health. In documents pertaining to Dr. Chrisandy, the data shows, in quotes, Nurse Hamill came into my office around or between 11 o'clock to 11:30 a.m. and went into my medicine refrigerator while I was in a meeting, and that thereafter at 11:53 a.m., my medical assistant notified me that there was a medical emergency. That patient was being injected by Diane Hamill and now could not see out of one eye, end of quotes. Even after this cosmetics emergency, Dr. Chrisandy entered her room full of agitation. There wasn't any welcoming disposition or display of pleasantness. As Crystal Touch requested to go to the ER, he ignored her and attempted to fix what Diane Hamill did in error to her nose, affecting her left eye. Crystal Touch did not appreciate how she had to wait for a significant amount of time, the way he yelled at her and treated her like an animal. So good thinking of Crystal Touch to take selfies that day. Crystal Touch had a large incision on the bridge of her nose that she took photos of. Dr. Chrisandy used a scalpel to open and inject medicine there. He attempted to fix the problem himself instead of promptly having a ride for Crystal Touch to visit the hospital ER. Sometime later, Crystal Touch hired an attorney, Dan Calvajo. He is representing Crystal Touch in her lawsuit against VIP Plastic Surgery, which is owned by the same doctor, Crystal Chrisandy. In regards to Diane Hamill, on her Instagram page, she markets herself as a master aesthetic injector. Crystal Touch had no idea of the side effects of Restylane. Crystal Touch's attorney, Dan Calvajo, informed her about her medical condition. Since veins run through the nose to supply blood and oxygen in the eyes, when Diane Hamill injected the Restylane, she occluded it. The Restylane filler added to the vein caused a stroke in her left eye. It blocked the flow of oxygen there. The main benefit of using Restylane is its ability to give natural-looking results. Usually there's very little downtime or discomfort after this type of injection. And Restylane has a unique formulation, which allows it to be absorbed very slowly into the skin over time. Usually it doesn't cause this blockage. And for those of you who had Restylane or have seen patients, it provides long-lasting effects with less touch-ups needed compared to other fillers like Juvederm or Restylane. And on many occasions, since Restylane is made up of hyaluronic acid that's found naturally in our bodies, there's less risk for allergic reactions. It's a better option than synthetic fillers like silicone or collagen-based products. Now, as an experienced attorney, Dan Calvajo directly said most physicians don't tell their patients the serious risk involved when using fillers. Now she must have frequent appointments to see an ophthalmologist and eye doctor on a regular basis. Since Crystal Touch is blind in the left eye, most days she's relearning basic skills. The ophthalmologist said there is a chance that Crystal Touch may become cross-eyed. Because of this medical mistake, so many tasks must be relearned, like driving, walking outside alone, and doing her everyday errands. A news station called 13 Investigates, with representatives who assist people with disability issues, tried to help Crystal Touch too. When 13 Investigates learned about Diane Hamill, it was very difficult because she tried to go into hiding. 13 Investigates were hired to track her cell number. While covering the story, the team left a voicemail message for her, and she replied by text instead of calling back. However, when investigators explained that they wanted to know her version of the story involving Crystal Touch, she became unavailable ever since. Diane Hamill has been dodging them consistently. Through 13 Investigates, they found public records of Diane Hamill being reprimanded by the state of Nevada. In 1998, she submitted fake data in order to have her license renewed. In my opinion, she lacks integrity and the skills to perform her job. Presently, Diane Hamill is not employed at VIP Plastic Surgery. However, she is still licensed and practicing at another cosmetic clinic. Hopefully, more people will do their research and find out about this medical catastrophe, this tragedy, before it's too late. Dr. Kersandi is still not willing to do an on-camera interview, but he is going to defend this lawsuit in court. YouTube family, there is more information about his medical errors.